Hi, my name is Tara, and in this video, I will draw and explain fetal blood flow in a simplified manner. And while my cat Tigger is picking out his colors, I encourage you to get out 5 colors, preferably including blue, red, and purple. I will start by drawing the heart. And I will label the left and right sides, which will be opposite than what you would expect because we are facing the heart. We also need the lungs and the body. I will split the body into the upper body and the lower body. We also need to talk a little bit about the placenta and the liver this time. I'll be a little more specific and draw the septum because there is an important hole known as the foramen ovale, which will serve as a shunt, as I will explain. Let's draw our heart valves. On the right side, we have the pulmonary semilunar valve and the tricuspid valve. And on the left side, we have the aortic semilunar valve and the mitral or bicuspid valve. I'll start blood flow coming from the placenta. We have the one umbilical vein, which will carry oxygenated blood from the placenta. After that point, some blood will go through the liver, but mom's liver is really doing most of the work. And so most of the blood will go through this important shunt known as the ductus venosus. The common iliac veins will merge to form the inferior vena cava, and that will bring deoxygenated blood in the lower body. And then the ductus venosus will feed oxygenated blood into that inferior vena cava. So up here, I'm drawing this portion in purple. Partially oxygenated blood enters the right atrium there. We have deoxygenated blood coming from the upper body. That will be delivered to the right atrium through the superior vena cava. Just as we would expect, some blood will go through the tricuspid valve into the right ventricle, and then through the pulmonary semilunar valve into the pulmonary trunk, which splits into left and right pulmonary arteries. I'm drawing a gap there to make something easier to draw later, as you will see. Now the lungs have a liquid environment instead of an air environment right now, so we have this pressure pushing back, and that pressure will make it easier for blood to instead flow through the foramen ovale. So a bunch of partially oxygenated blood goes from the right atrium to the left atrium. We have deoxygenated blood coming from the lungs. There are 4 pulmonary veins. There is the right superior, right inferior, left superior, and left inferior. Those pulmonary veins will bring deoxygenated blood into the left atrium. Just as we would expect, the blood will go through the mitral valve into the left ventricle, and then through the aortic semilunar valve into the aorta. I'm drawing this curving around these other vessels because I want to show the aortic arch. Branching off of that, we get 3 arteries, which will deliver this partially oxygenated blood to the upper body. These will support the blood flow needs of the head and neck, the right arm, and the left arm. At this point, something interesting happens. There is another shunt known as the ductus arteriosus, and it will dump a bunch of deoxygenated blood into the aorta. Again, because of that pressure, it will be easier for the blood to flow this way. The aorta will continue. It will be called the descending aorta. This will travel behind the heart And once it reaches the abdomen, it will be called the abdominal aorta. The abdominal aorta will split into the common iliac arteries. Each of those then splits into external and internal iliac arteries. All of these will carry blood to the lower body. Off of the internal iliac arteries, we get two important arteries known as the two umbilical arteries, carrying the deoxygenated blood back to the placenta and completing our blood flow. So remember, we learned three important shunts. The ductus venosus, the ductus arteriosus, and the foramen ovale. What happens after the baby is born? Well, as it breathes air into its lungs, this pressure will no longer be so high, and it will no longer be easier for the blood to flow through the foramen ovale. After birth, this will eventually close off normally. The ductus arteriosus will be obliterated and then called the ligamentum arteriosum, and the ductus venosus will be obliterated and called the ligamentum venosum. The umbilical cord will be cut and tied, and the umbilical vein will become the ligamentum teres, and the umbilical arteries will be called the medial umbilical ligaments. Our colors will also change because there is now oxygen coming from the lungs. So the pulmonary veins and the blood flow beyond that has now turned from purple to red, as well as this downstream deoxygenated blood, just turning from blue to red. Now we have what blood flow looks like after birth. Please like and subscribe if you enjoyed this video. Happy studying!